Hey there, Dr. Amanda English here. I am a doctor of Naturorthopathics, which translates to naturally correct conditions. I'm also an ordained whole medicine and healing minister. And I am doing this video series to offer a video synopsis of the book Invisible Tears. And in this one, this is series 1, The Genetics of Alcoholism. Okay. So, and believe me, I'm not all fancy dancy and hoity-toity. These presentations are what give you something else to look at besides me, and they also keep me on track with the information that I am sharing. So, disclaimer out of the way: this presentation is for educational and informational purposes only. It's not intended as a diagnosis, treatment, or substitute for medical advice. Please consult your medical providers for all of your medical needs or concerns. And just to share a little with you, my path was guided towards understanding root cause and methods of natural healing regarding all conditions. But my thesis was on alcoholism because I have had my own battle and struggle with that. And the same concepts and principles apply to any addiction and indeed many other conditions. So again, my thesis was on alcoholism, which I'm now formulating into the Invisible Tears series. So what we're going to cover and what this is all about. This is my mission. I also consider it my ministry because I'm not smarter than anyone else. I just have a different set of knowledge that I want to share, and that will offer you a different perspective. So this synopsis of Invisible Tears Series 1, Genetics of Alcoholism, the purpose of Invisible Tears is to offer more updated and comprehensive insight into alcoholism and diminish the primitive stigma that still remains, as well as to highlight the limitations of conventional approaches and the importance of expanding those approaches to a more individualized and natural healing that integrates all components of the human being, which are intimately interconnected. By offering more insight into this deadly pandemic, my mission is to diminish the primitive stigmas that still remain. Okay? And though science has advanced enough that we understand so much more about this disease, definitely not everything, but we have identified all these genetic factors, but this is not common knowledge. And so we are still stuck in this primitive state of mind that we have been for thousands of years, that alcoholism has something to do with moral weakness or lack of willpower. And now we know it has nothing to do with those things. And so hopefully the sharing of this information and going deeper into this will help you to gain that perspective. Also, definitely to ease the guilt and shame of those who suffer, which is a profound barrier because they do not understand any more than you do. Okay? They cannot stop any more than you can make them stop. Right? And also to reduce the feelings of anger, hurt, confusion, neglect, and all those other negative emotions for children and loved ones. And I highlighted children because this is so important too. This information should be shared with them at an age appropriate level, of course. But, even some of you watching may still be harboring hurt, maybe even resentment and bitterness and feelings of neglect, like, you weren't loved enough, you weren't worthy to be loved enough, different things like that. And so this is very important for children to understand as well. And to cultivate the compassion, support, and care needed for all who are affected. All right, that's my mission. And I also consider this my ministry. All right, so this whole presentation for series 1 is quite lengthy, so I'm going to break it up into segments because let's be honest, Most people can sit and watch a 5 or 10-minute video. They're much more willing to do that than sit and watch an hour-long video. All right, so we're going to take some breaks and give you the opportunity to just come back and watch the next one. But so this is just the preface. We will get into the nitty gritty in the subsequent video, but this is important, just as important. So definition and understanding: alcoholism or alcohol use disorder is a chronic condition characterized by compulsive drinking despite negative consequences. Now, I highlighted the word disorder because those words, disease and disorder, are often used interchangeably. In the medical field, the difference is a disease has a known cause and a disorder does not, or there's no single identifiable cause with a disorder. Okay, but let me throw you for a loop here. No matter what disease you might be diagnosed with, whether it be diabetes or heart disease. Okay, insulin resistance is not the cause of diabetes. All right, it is a symptom of the cause, and for most all conditions and diseases that we develop, they are strongly correlated to toxicity, acidity, and deficiencies. Those are the three main ones. The acronym is TAD, and when we can change things just a tad in a progressive way, we can heal tremendously. But that's for another video. Despite negative consequences. So, we have people that might be very habitual drinkers, and they might be very stubborn about it. However, when certain situations or things arise, they are able to stop without the threat of death, which we will talk about in a minute, and other things like that. So it impacts physical, mental, emotional, and social well-being, making it uniquely challenging to treat and understand. Okay, overcoming alcoholism involves confronting various barriers. The umbrella barrier being lack of knowledge. Okay, that's why we still have this very primitive and stigmatic view. And lack of effective treatment and support. Falling under this umbrella are genetic barriers, epigenetic barriers, which are things that are come from environmental and experiential influences that alter our genetics, meaning it can switch genes on or off. Physical barriers, such as withdrawal symptoms that may even lead to death. Barriers of brain chemistry with psychological implications. Nutritional barriers like deficiencies. Societal barriers, again, the stigma, judgment, shame, economic and financial barriers, and spiritual barriers. So these are the things that we will dive into in this whole series. But in this first book and in this first video series, we are looking at the genetic barriers. Okay, so the impact of primitive stigma. So stigma surrounding alcoholism has existed since the formulation of alcohol. You can, in the Bible and everywhere. It's often seen as a moral weakness or lack of willpower. Despite scientific advancements and better understanding this disease, collective society still has a very primitive view and understanding. Stigma not only exacerbates feelings of shame in individuals, but also reduces their chance of seeking help due to fear of judgment. Many individuals may feel hopeless as their innate desires for acceptance and purpose are often crushed by the grip of addiction. Okay, so in this, we will cover a holistic approach to understanding. The holistic approach to alcoholism considers the interplay between the physical, mental, emotional, social, economic, and religious and spiritual implications. Not only are we born with a particular genetic makeup, but those genes may be switched on or off due to influential factors, epigenetics. There is a crucial need for comprehensive treatment strategies that address all aspects of the human being and individual life. Okay, so that is it for this one. I'm going to let you take a break, take a breather, and come back to the next video whenever you like, and we will get more into the genetic aspect. So thanks for joining me for that introduction to this, and I will see you in the next video. Blessings.